A game-changing genetic test is opening doors to create more personalized care with men diagnosed with prostate cancer. And to put that in perspective, according to the American Cancer Society, prostate cancer is the second leading cause of cancer death among American men, and 1 in 6 men will receive a prostate cancer diagnosis in their lifetime. Here to talk more about the breakthrough in medical care is Dr. Jeremy Lieb and Mr. Al Piazza. Good morning to you both. Thank you for being here.
Thank you.
Thank you, Stephanie.
So talk quickly just a little bit about prostate cancer and the scary issue that men face with this.
Prostate cancer is very common. It's the second leading cause of cancer in adult men and the second leading cause of adult men. So often when they get the diagnosis, it's an emotional process. Men get very worried and unfortunately sometimes overreact.
And Dr. Lieb, what is it that we need to look out for? What kind of testing do men need to get done to kind of make sure they're kind of ahead of the process here?
Yeah, the key is seeing your doctor, is getting your prostate blood test, the PSA test, having your prostate exam done, and if there's an abnormality, getting referred to a urologist who you trust, so you can continue to do the testing and possible prostate biopsies if necessary. And
Mr. Al Piazza, what are some of the most pressing decisions that you have faced as well when dealing with this issue?
Well, I have to tell you, Stephanie, it was pretty emotional. My whole future just literally stopped in front of me. It took me to my knees. I had no idea what I was going to do in my future. Getting with Dr. Lieb, we had looked into some procedures that could be done, surgery, radiation treatments, and if you know anybody that's had prostate cancer or any kind of cancer, the results of both of those are horrific, and it's something I just definitely did not want to go through.
So where do things stand with you right now? You had your prostate removed, as I understand it, right?
No, that is not right. What happened was we had gone to this Dr. Lieb had talked about, and the result of that test allowed me to determine in a 10-year time frame what the chances of my cancer progressing to a level that would be more severe. And fortunately for me, it was at a low rate, so it allowed me to make an educated decision. Now that I knew where my cancer stood as far as its progression, I could determine, do I need to have the surgery? Do I need to have it removed? Or should I just wait and watch? And that's the decision that Dr. Lieb and I had determined we were going to do. No reason to do any kind of intrusive surgery if it's not necessary. And for a male, it's a horrible thing to have to go through that.
And Dr. Lieb, as we close here, what do you really want people to know, the men out there, to kind of keep an eye out for, you know, to avoid this? I know cancer is unavoidable, but what do they need to be looking out for? What kind of health tests do they need to keep up with to get the best care possible?
Yeah, the key take-home message here is to understand that many men are diagnosed with prostate cancer, but surprisingly, many patients can live with prostate cancer without jumping into quick surgery or quick radiation decision. We use the PSA blood test, the exam, and the biopsy tissue to get information to diagnose the cancer. The Prolaris test is a new genetic test that looks at the prostate cancer cells. It's individualized for every patient who's diagnosed with prostate cancer. It can help the urologist determine whether this is a more aggressive or less aggressive cancer. It gives us the 10-year risk of this patient dying of prostate cancer. Then it takes a lot of the urgency away. It allows the patient to consider all the options, to consider surgery, to consider radiation. And if it's necessary, yes, go get a treatment and get cured and take care of it. But most men can live with prostate cancer without pursuing aggressive treatment, and that's the key here. This is a brand new genetic test, and I personally believe that genetic tests on cancer are the wave of the future. This is where we're going with cancer treatment in the future, is trying to individualize the care for each patient so we don't overtreat and we don't undertreat.
Dr. Lieb, Mr. Piazza, thank you both so much for just spreading awareness on this pressing issue. We really appreciate you being here, and we're going to have more information on our website. You can go to fox4morningblend.com. One last look at today's Fox forecast, and we'll be right back.